Today's medical-centric topic is Fosfomycin use in complicated UTIs. What's new? Why fosfomycin is getting attention again. Fosfomycin used to be a niche antibiotic, mostly for simple cystitis. But with rising resistance to common UTI drugs like fluoroquinolones and TMP-SMX, clinicians are revisiting old options. Fosfomycin's unique mechanism and broad urinary activity make it valuable, especially in complicated urinary tract infections, UTIs, where resistant organisms are common. What fosfomycin is and how it works. Fosfomycin is a bacterial antibiotic that inhibits an early step in bacterial cell wall synthesis. Its structure is different from beta-lactams and other classes, so it retains activity against many multi-drug resistant organisms. It is excreted unchanged in the urine at high concentrations, making it excellent for lower urinary tract infections. Defining complicated UTIs. A complicated UTI typically involves structural or functional abnormalities like obstruction, stones, catheters, prostasis, diabetes, immunosuppression, or resistant bacteria. These infections are harder to treat, more likely to recur, and often require broader-spectrum antibiotics. Old versus new, expanded roles in UTIs. Traditionally, fosfomycin was used as a single-dose oral option for uncomplicated cystitis. Recent evidence supports its use in more complex situations. Recurrent UTIs when other drugs fail or intolerance exists. Multi-drug-resistant enterobacteriales, ESBL producers, some carbapenem-resistant strains. Prostatitis and male UTIs when combined with other agents. More on that below. Spectrum of activity and resistance issues. Fosfomycin remains active against many gram-negative pathogens, including ESBL-producing E. coli and Klebsiella. It also has some activity against Enterococcus and Staphylococcus. However, resistance can develop, especially in monotherapy and prolonged exposure, so culture guidance is critical. Dosing in complicated UTIs. For uncomplicated cystitis, a single 3-gram oral dose, fosfomycin tromethin, is standard. In complicated UTIs, multiple dosing regimens have been explored, such as 3 grams every 48 to 72 hours for several doses. In prostatitis, fosfomycin is often used in combination, that is, with fluoroquinolones and aminoglycosides, and given over weeks, not single doses. Safety and tolerability. Fosfomycin is generally well tolerated. Common side effects include mild gastrointestinal upset and diarrhea. It does not require dose adjustment for most renal impairments, but severe renal dysfunction still calls for caution. Culture-directed use is key. Because resistance patterns vary widely, fosfomycin is best used after urine culture results and susceptibility data guide therapy. Empirical use should be cautious, especially in severe UTIs. Why it's gaining ground now. With rising global resistance and few new antibiotics in the pipeline, fosfomycin's unique mechanism, safety profile.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.